Sex addiction, scientifically known as hypersexuality disorder, is one of the most controversial and misunderstood addictions of the modern world. It is not just about frequent sexual activity. It involves loss of control, persistent sexual behaviors despite negative consequences, and a cycle that deeply affects a person's daily life. But is sex addiction really an addiction? How does it affect the brain? Is there a cure? Sex addiction is characterized by an inability to control repetitive and compulsive sexual behaviors. In 2018, the World Health Organization classified compulsive sexual behavior disorder as a mental health disorder. However, the DSM-5, or Diagnostic and Statistical Manual of Mental Disorders, does not officially recognize sex addiction as a disorder. Sex addiction can manifest in various forms, including compulsive masturbation, excessive pornography consumption, frequent partner changes, dependency on sex workers, and risky sexual behaviors. Sex addiction is linked to the brain's reward system, similar to other addictions such as drugs, gambling, and alcohol. Research shows that sex addicts experience an increase in dopamine release. Dopamine is a neurotransmitter associated with pleasure and motivation and plays a crucial role in addictive behaviors. MRI scans have revealed abnormalities in the prefrontal cortex, the decision-making center, and the amygdala, the emotional response center, of individuals with sex addiction. These abnormalities make it difficult for them to regulate risky sexual behaviors. Many people wonder whether frequent sexual activity qualifies as an addiction. However, sex addiction should not be confused with a high libido. A person with a high libido can control their sexual urges and fulfill them without negatively impacting their life. In contrast, someone with sex addiction cannot control their impulses, leading to significant harm in their work, relationships, health, and psychological well-being. Sex addiction is not just a personal issue. It has devastating psychological, social, financial, and physical consequences. Psychologically, it can lead to depression, anxiety disorders, shame, and low self-esteem. Socially, it can cause infidelity, trust issues, and divorce. Financially, excessive spending on sex workers and adult content platforms can lead to severe economic problems. Physically, it increases the risk of sexually transmitted diseases and chronic fatigue. Sex addiction is treatable. Cognitive behavioral therapy, group therapies such as Sex Addicts Anonymous, and medication are effective treatment options. Dopamine-regulating medications in particular can help individuals manage their impulses. It is crucial to understand that sex addiction is not a moral weakness but a brain disorder. Seeking support is the first step toward overcoming it. Technology, the internet, and easy access to adult content are among the biggest triggers of sex addiction. Pornography addiction, dating app culture, and virtual sex make it even harder to control sexual behaviors. Today, millions of people struggle with sex addiction without even realizing it. If you or someone you know exhibits these symptoms, seeking professional help is essential. Raising awareness through more scientific research and education is necessary to break the myths surrounding sex addiction and spread the truth. Don't forget to share this video to help increase awareness.